Hey, what's up? It's Bentley and welcome back to my channel. I am a month late, but I am doing my 3-year on T update, so I guess it's a 3-year, 1 month on T update video. Sorry, I'm so busy. But basically, I've been doing the intramuscular injections in my leg for 3 years. I have taken a little break and done the gel. So some of it has been gel. A couple months have been gel. Most of it has been injections. I'm back on injections just because the gel, I have a hairless cat and it's just like, I can't there's no good time to put on the gel when you have a cat that's like all over you all the time. So I don't want to like spread it to her. So I'm back to injections. What I noticed when I switched from gel, my skin got softer again when I was doing the gel, which I know you're technically on the same dose, but when I started injections up again after I had switched to gel, the injections were a lot easier to do the first couple weeks, and now my legs are hard again and it's harder to do, which is part of the reason why I stopped doing injections, because it hurts so bad because my skin is thick. But taking a break and doing the gel for a bit made my skin softer, which is making me think that the gel wasn't as potent and wasn't working exactly how I wanted it to. But I don't know, because my blood work is coming up next week and we'll see what's up. I didn't keep it going for long enough to do blood work just on the gel because of my cat, and yeah. So let's see, I've lost a little bit of hair here, which is good. A little bit. Kind of hard to tell because I just shaved it, but there's that. My eyebrows have gotten substantially bigger. Bushy. Big. Yeah, yummy. I finally kind of have a mustache. Look at that. Oh my god. Finally, took like 3 years. I got some chin hair. It does grow on the sides, like long, but it's all blonde. So like it'll be like really long and thin and blonde, and just like, I don't like it because you can't really see it, and then up close it's like all thin and like it's not thickening on the sides. It's just like, it feels like head hair where it's soft, but it's even like thinner than my head hair, and it's just all blonde. So I'll like look and it'll be like two inches long, and it's just like these little soft blonde hairs, and I'm not really a fan of that. So I've just been shaving that part. I have not ever shaved my mustache, ever. I kind of want to test it out and shave, but I don't know. I think my dysphoria would be so bad that it's not really worth the risk of testing out what would happen or how it would grow back, because it's really cute, and if I don't have it, I might die. So I don't know. But yeah, so it's definitely changed the facial structure. I have like, at least on this side too, I have more of a jawline. I think this side's a little softer, but I didn't have like this jawline when I started T. It was very round, so it's definitely squared out my face. I have been going to the gym and rock climbing, and it's definitely helped me build more muscle. It's not like I'm like ripped or anything, but like this muscle that I do have, there's like no way I could have built this before I was on T. And I think that's pretty cool, because I used to just kind of be like a spaghetti noodle, and now I'm just like a slightly stronger spaghetti noodle. So that's cool. But yeah, it's made my endurance a lot easier. I can like hike up a mountain and just go. And I really have no problem like working out at all. I just can go, which before I started T, I had a really hard time, and I was really sluggish all the time and just depressed, and like the hormonal changes of like having a cycle and stuff just like really messed with me physically. And I feel like I could never get in a schedule of like working out in a healthy way, because like you have your cycle and then you have like the emotional time, and it was just all this stuff. So like now that my cycle's gone, it has been so much easier to manage, like taking care of myself and like sleeping and just being happy and going to the gym and hiking and stuff when I want to, and I don't have to worry about any of the other bullshit that I had to before. So that's a positive. It has given me approximately 5 chest hairs. Can't even see them. I do have like 5 chest hairs. So, thanks. They're all growing like right where my scars are, which is weird. Like the rest of my chest isn't getting any hair at all. It's just like where my scars are. And then I have one hair that like grows through my nipple sometimes, which is weird and creepy because I can't feel my nipples. And then I pull it out and it's very strange. But yeah, so I haven't really gotten much of that. I have gotten a ton of leg hair, if I show you here. So all of this leg hair was non-existent before T, like none of it. It was just bald up here. It's still kind of bald right here, but I did not grow any hair on the top of my leg or on my knee until I started T. So it's just been growing in a lot more this year. Yeah, it used to stop like underneath my knee, and then there was no hair. and now I have dark hair everywhere. I love it. I wish there was more, but it's coming in. My arm hair has gotten thicker. It's kind of hard to see with my tattoo, but that's gotten thicker. It's gone onto my hand, which it was not on my hand before I started T. I'm a drummer, and like I have like weird arthritis, so I don't know if my hands got more like masculine with T, or it's just from drumming and beating them up, but there they are. I'm not sure. They hurt all the time. I don't know. But yeah, other than that, physically, I just have been able to like build more muscle easily. I am trying to get the shape I like. I'm trying to get rid of my like waist section. It has helped slim out my butt and my hips quite a bit, but there's still just like, I get a lot of dysphoria like looking at that stuff. But if I look at pictures, it is a lot better than it was before I started T. So like, even though I see it and like, I'm like, oh, I got hips, like they're not nearly as big as they were because the fat has moved around and redistributed in my body. So that is a big plus. I think that's about it physically. I mean, my voice hasn't really gotten any deeper in the last year because I think that just stopped getting deeper, or at least mine did. But mentally, I'd say it's just awesome to not have a cycle, because then I don't go through the terrible PMS emotional bullshit that happens when you have that. I feel like I think more logical now. I question like everything in a different way than I did before. I'm more chill for the most part. I was on some like ADHD meds that were kind of making me angry at times, but now that I stopped those, I've chilled out. And a lot of people say that tea makes you angry, but that is not my experience. The only time I had to experience anger when I was taking Vyvanse, and then I stopped taking that. And now I'm not really angry anymore. I'm just sad sometimes. Yeah. So I think it's also just boosted my confidence, because I pretty much like pass in public most of the time. The only people that still misgender me are people I knew before I transitioned, which after this many years, it's really fucking annoying, but what do you do? I mean, I work with them and stuff. I can't really do much because I don't want a new job. So just deal with it. It's not often, like, and they feel bad when they do it, but it's still just annoying that happens, because like I'll forget that I'm trans, and then like someone will misgender me and I'll be like, and then they apologize and they're like, and I'm like, and then I just try and like go on with my day. It doesn't like bother me, like it doesn't ruin my day or anything, but just disturbing, because like I'll go like a week without like really thinking about being trans, except for when I'm going pee or something, and then like someone misgenders me and I'm like genuinely confused, because I'm like, oh, that used to be me, I guess. I don't know. Kind of awkward. But yeah, so mentally I think I'm just way better, more chill, more positive thinking. I have less anxiety in like public settings now, because I feel like I'm me, and like anybody that sees me that hasn't met me before like gets to meet like me, so I don't have to like pretend or like try to like be like, yeah, I'm a dude now, because like I just am that, which is really nice. And all of this I'm speaking from my own experience. I'm not saying that you're not a dude if you haven't like done anything. I'm just saying, like, from my experience, like the way people treat me, this is like my thought process. You don't need to be on hormones or have surgery or anything to be valid, and your pronouns should be respected no matter what, even if you don't want to have surgery or you don't want to take hormones. Everyone should respect you. But I'm just saying, from my experience of like how people treat me and like how I navigate the world, that's like what I'm talking about. So anything in this video is my experience and mine only. I'm not speaking for any other trans person ever, because everyone has a completely different experience with everything. I've had great experiences with all my doctors and surgeons, and like it's been pretty good. Like I've had to educate some doctors on like when I had atrophy, which is from T, so that was really annoying. And like there's been a few other things where you kind of have to like educate them, but like nobody has been mean. All of them were willing to learn, and it's not necessarily their fault that they haven't learned that. They're busy doing other stuff, and like it's not that common that they see trans patients and stuff. So like I don't mind doing that to them. But like any doctor I ever had that like didn't know something, like apologized and like was like, please teach me, help me out, and they ended up like helping me in return, and it was all great. So yeah, I think even my endocrinologist, he doesn't see a lot of trans dudes, but like he treats me like any normal person. He's not like weird about it or anything. He asks me all the questions he needs to ask and moves on, and just, he's super cool. Yeah, I'm gonna do a video about my terrible 6 months to a year almost a year of figuring out that I had atrophy from T, how terrible that was, how I fixed it, how long it took, all that. So that'll be my next video, just my journey on all those terrible things that they don't teach you about, and you got to learn on YouTube, and then you got to teach your doctor about it. So yeah, next video will be about my atrophy and stuff like that, and how I'm okay now. If you have any questions, you can always hit me up on Instagram at Titty Graveyard. That's one word. That's also my solo project. I have an album coming out under that name. Check out my band, Snailmate. We're going on tour in a month or so. So check us out, Snailmate. We're fun. We'll be around the country, around the world this year, so we'd love to see you and say hi. You can check out my Etsy shop and my clothing line at tittygraveyard.apparel on Instagram, and it'll bring you to my Etsy shop. But yeah, other than that, keep being yourself. Fuck the haters. If anybody tells you you're not valid, fuck them. They don't matter. They don't matter. Because you are valid no matter what your journey is. If you don't want surgery, if you want surgery, if you want every surgery, if you don't want to ever talk about surgery, if you don't want hormones, if you want hormones, like, you are all valid. Your pronouns are valid. And that's it. If anybody's trying to be mean to you, just fuck them. You're amazing. Anyways, find me on Instagram. Let's chat at Titty Graveyard. Love y'all. Bye.